Welcome to Dr. Speak, first in a series of presentations about health literacy and the healthcare professional. This presentation will provide an overview of health literacy and what you, as a healthcare professional, can do to ensure effective communication and better health and well-being for your patients. Future presentations will cover conveying risk, creating easy-to-read patient education materials, and cultural considerations. Why start with literacy? Sometimes the problem is not just health literacy, but the ability to read or write at all, particularly if English is not the first language. You may be more familiar with general literacy, which is often reflected in the simple question, can you read? General literacy is the ability to function in today's society and goes beyond simple reading ability. Literacy represents a collection of skills, including reading, writing, basic mathematical calculations, listening, speaking, and cultural and conceptual knowledge. Health literacy challenges these general literacy skills by placing them in the complex context of the healthcare system. So while they are both connected, they are different. The definition of literacy has changed over time, largely due to 1, changes in the physical materials that are used to display writing materials, such as computer screens, and 2, changes in the criteria that a given society or culture understands and measures literacy, such as social status or vocation. Literacy is more than just a reading level. There are 3 basic types of literacy. Prose literacy, which is the knowledge and skills needed to perform prose tasks, such as the ability to search, comprehend, and use continuous text like instructions. Examples include editorials, news stories, brochures, and patient education materials. Document or graphical literacy is the knowledge and skills needed to perform document tasks, such as the ability to search, comprehend, and use non-continuous text, that is, text in short forms in various formats. Examples include job applications, medical forms, transportation schedules, maps, tables, and drug and food labels. Quantitative or numerical literacy is the knowledge and skills required to perform quantitative or mathematical tasks, such as to identify and perform computations, either alone or sequentially, using numbers embedded within printed materials. Examples include balancing checkbooks, interpreting blood pressure readings, or keeping medical appointments. According to the American Medical Association, literacy skills are a stronger predictor of a person's health status than age, income, employment status, education level, and race or ethnic group. The National Assessment of Adults Literacy, or NALL, is a nationally representative assessment of English literacy among American adults age 16 and older that's been conducted periodically by the National Center for Education Statistics. The 2003 NALL, the last one conducted, included a representative sample of over 19,000 adults over the age of 16 from all 50 states and Washington, D.C. The results of the NALL revealed 14% of the adults were functionally illiterate, that they could only perform the most simple and concrete literacy skills, and 29% of the adults had only marginal literacy skills. They could perform simple and everyday literacy activities. Only 13% of the adults were proficient or could perform complex and challenging literacy activities. It also revealed that 60% of adults over the age of 65 had inadequate or marginal literacy skills, and that the average reading level in the U.S. is at the 8th grade, with 20% reading at the 5th grade level or below. How do poor readers differ from good readers? In contrast to good readers, most poor readers do not read strategically. They start reading without considering why they are reading the text and what they hope to learn from it, which can affect their comprehension of the text. During reading, poor readers may have difficulty applying knowledge of letter-sound relationships, and so have difficulty reading the words of their texts accurately. In addition, some poor readers read too slowly or lack fluency. Due to their slow, labored reading, they often do not comprehend much of what they read, and the attention they have to give to figuring out the words keeps them from understanding the text message. Often, poor readers lack sufficient background knowledge about the topic of a text. They may have trouble connecting the ideas of a text. They generally are not familiar with the vocabulary they encounter and have trouble determining word meanings. Even when poor readers possess relevant background knowledge, they frequently are not able to activate it to help them understand what they read. After reading, poor readers typically do not think about or reflect upon what they have read. They almost never seek out additional information about a topic. When the Department of Education conducted the 2003 NAL, they added a new component, a set of 28 questions that were specific to determining health literacy levels. The health literacy questions specifically assess the ability of adults to use their literacy skills when trying to understand health-related information in clinical situations, preventive healthcare, and navigating the healthcare system. The majority of the questions concentrated on preventive healthcare and health system navigation, as they are more applicable to the majority of the population. Examples of tasks at each level: for below basic, they were asked to circle the date on a doctor's appointment slip. For basic, they needed to give 2 reasons a person with no symptoms should get tested for cancer based on a clearly written pamphlet. For intermediate, they were asked to determine what time to take prescription medicine based on a label. And for proficient, they were asked to calculate employee share of health insurance costs using a table. The results showed that only 12% of adults are proficient in understanding health information, and 36%, or more than 1/3 of adult English-speaking Americans, are at the basic or below basic health literacy skills. An analysis of the 2003 NAL results discovered that 51% of the adults in below basic health literacy did not graduate from high school. 48% had 1 or more disabilities, and more than 1/3 were either over the age of 65, had no medical insurance, English was their second language, or were Hispanic. Regina Benjamin, the U.S. Surgeon General from 2009 to 2013, declared in 2010 that health literacy was a national priority. 3 major initiatives in 2010 collectively put in motion attention to the consequences of and remedies for limited health literacy. These were the Affordable Care Act, the Health Care Reform Law of 2010, the National Action Plan to Improve Health Literacy from the Department of Health and Human Services, and the Plain Writing Act of 2010, which requires federal agencies to write documents in a clear, concise, well-organized manner so that the public can understand and use them. The Affordable Care Act directly and indirectly addressed health literacy by incorporating health literacy into professional training and streamlining procedures for enrollment into Medicaid, the Children's Health Insurance Program, CHIP, and the state-based insurance exchanges. The National Action Plan to Improve Health Literacy was developed after considerable public and professional input. It is based on the following 2 principles: that all people have the right to health information that helps them make informed decisions, and that health services should be delivered in ways that are understandable and lead to health, longevity, and good quality of life. Scott Simmons, professor of health education at the University of Michigan, was the first to use the term health literacy in 1974 to describe how health information impacts the educational system, the healthcare system, and mass communication. The concept of health literacy was not introduced into healthcare literature until the early 1990s. Healthy People 2010 adopted the first formal definition in 2000, which stated that health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Health literacy as a concept progressed from describing and defining the literacy skills of the adult population to the understanding that adequate, if not advanced, literacy skills are necessary to assess, navigate, and understand the healthcare system due to the increasing emphasis on self-management of health and disease. This definition was updated in 2010 with the passing of the Affordable Care Act. The new law added only 1 word to the earlier definition: communicate. The Affordable Care Act defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand health information and services in order to make appropriate health decisions. However, over time, researchers in the health literacy field felt that the previous definition did not go far enough, as it focused too much on the patient and their responsibilities or capabilities. The definition of health literacy used in earlier iterations of the Healthy People initiatives in the Affordable Care Act was updated and expanded in August 2020 with the release of the Healthy People 2030 initiative. Healthy People 2030, the fifth iteration of the Healthy People initiative, provides science-based national health objectives with targets to improve the health and well-being of Americans. For the first time since its 1979 establishment, the Healthy People framework aims to attain health literacy as an overarching goal and foundation principle to achieving health and well-being. The Department of Health and Human Services Secretary's Advisory Committee proposed the new definition saying, health literacy occurs when a society provides accurate health information and services that people can easily find, understand, and use to inform their decisions and actions. In a health literacy issue brief, the Secretary's Advisory Committee noted, as health literacy research and practice have accumulated, we have now more fully understand that responsibility for health literacy extends beyond individuals to include the organizations and professionals who create and deliver health information and services. The new definitions emphasize people's ability to use health information rather than just understand it, focuses on the ability to make well-informed decisions and actions rather than appropriate ones, incorporates a public health perspective with personal health literacy be used to promote the health of others, and acknowledges that organizations have a responsibility to address health literacy. Including a focus on taking health-related action reinforces the idea that improving health literacy does not end when a person understands health information and how to use health services. People must be able to use the information and services to not only make decisions, but also take action, whether at the healthcare provider's office, at home health care facility, or at home. Although initially the responsibility for health literacy focused on individuals, there is increasing recognition that governments, health and community service providers, researchers, and consumer groups are all equally accountable. The adoption of a definition for organizational health literacy signals that personal health literacy is contextual, and the responsibility for health literacy does not rely solely on the individual. The definition also points out that organizations must be equitable in how they address health literacy. In its simplest terms, health literacy is the ability of the individual to find, understand, evaluate, communicate, and act or use the health information to make decisions. This applies equally to healthcare providers or patients, as they both need these abilities. Helen Osborne, author of the award-winning book, Health Literacy from A to Z, Practical Ways to Communicate Your Health Message, says, health literacy is a shared responsibility between patients or anyone on the receiving end of health communication and providers or anyone on the giving end of health communication. Both must communicate in ways the other can understand. My health literacy definition has consistently focused on the goal of mutual understanding. In today's healthcare environment, patients are encouraged to take an active part in making decisions about their own disease process and to be engaged in shared decision-making discussions regarding health treatment goals and approaches, potentially resulting in better health outcomes. However, the healthcare system isn't easy to understand or navigate. There are more medications, tests, and procedures. Patients have more options and are expected to be able to choose the best one for them. Shorter hospital stays, multiple pharmacy and healthcare providers, and the rising prevalence of chronic disease all contribute to the increasing role that patients have in managing their own care. Healthcare providers often overlook health literacy in everyday patient care, overestimating a patient's health literacy skills by assuming that any health information or instructions they provide, patients will understand. Patients frequently fail to recognize their own shortcomings in comprehension and overestimate their recall of important information. The health information they are given is often communicated at a very high level, 12th grade or higher, when the average American reads at the 8th grade level. Most patients do not have the resources to successfully share in decision-making, as they need skills to communicate effectively, to obtain, understand, and share information with health professionals. Healthcare providers want patients to eat right, exercise, use sunscreen, and have regular dental exams. There are many more immunizations to give. We ask them to assess their health status using glucose testing or a blood pressure monitor. We ask them to adjust their medications as needed. We expect them to know exactly when they should go to the clinic or the emergency room and follow up on all of the referrals we make. And of course, we always expect that they will understand the ins and outs of their insurance. Health literacy is considered an essential life skill. It contributes to the ability to take responsibility for one's health and healthcare decision-making, locate health information, and communicate on health matters with healthcare providers, calculate dosages and interpret test results, and to take action to improve personal and community health, as well as navigate healthcare systems, filter, interpret, and evaluate or understand health risks and evaluate information for credibility and quality. In order to accomplish these tasks, individuals may need to be visually literate, be able to understand graphs or other visual information, computer literate, able to operate a computer, information literate, able to obtain and apply relevant information, and numerically or computationally literate, able to calculate or reason numerically. Don Nutbeam, a social scientist at the University of Sydney with research interests in the social and behavioral determinants of health that includes health literacy, defined 3 levels of health literacy: basic or functional literacy, sufficient basic skills in reading and writing to be able to function effectively in everyday situations. This means being able to read health-related pamphlets or read the label on a pill bottle. This definition has been adapted by the AMA Council of Scientific Affairs as the ability to read and comprehend prescription bottles, appointment slips, and other essential health-related materials required to successfully function as a patient. Then there's communicative or interactive literacy, which involves more advanced cognitive and literacy skills. At this level, a person can read and interpret health information from the internet and discuss this with a physician while negotiating treatment. Critical literacy involves more advanced cognitive skills, which, together with social skills, can be applied to critically analyze information and to use this information to exert greater control over life events and situations. A person with critical literacy can effectively self-manage, ask for help when appropriate, and make informed decisions. Patients that display critical health literacy are known as the easy patient. They come on time and are prepared, understand the problem, and can explain cause. They remember information, pose smart questions, and comply with therapy. Going back to the 3 types of literacy mentioned earlier, a PROS health literacy example would be a patient handout. Patients need to read and understand patient education materials about procedures, diseases, and diagnosis. Or understand and assign consent forms. Document literacy examples. If a diabetic or hypertensive, the patient needs to be able to read nutrition labels for sugar or sodium content, take medications according to directions, and be able to do the math to manage diets, medications, and understand risk. So, who is at risk for low health literacy? The bottom line is that we all are. 90% of the population don't have the skills needed to manage their health and get the care they need. Anyone in the U.S., regardless of age, race, education, income, or social status, can be at risk for low health literacy. Ethnic minority groups are disproportionately affected by low health literacy. The majority of people with low literacy skills in the U.S. are white, native-born Americans. Older patients, recent immigrants, people with chronic diseases, and those with low socioeconomic status are especially vulnerable to low health literacy. Education, languages spoken, health behaviors, and health system characteristics all contribute to variations in health literacy levels across the U.S. Health literacy is critical when we consider who is most at risk in our changing demographics in Minnesota. We have an aging population. The Minnesota State Demographic Center projects that the number of Minnesotans aged 65 years will increase by nearly 400,000 people to 1.3 million, or a fifth of the state population, by 2030. And Minnesota's oldest residents, aged 85 and above, are expected to more than double in the next 35 years, from the current 120,000 to over 270,000. The elderly represent a population that is surviving longer with more complex and long-term medical needs. We are also becoming more and more diverse. Between 2010 and 2018, Minnesota added 5 times as many people of color as non-Hispanic white residents. The fastest growing racial group in Minnesota was the Black or African American population, which grew by 36%. Second fastest was the Asian population, which grew by 32%, followed by the Hispanic population, which grew by 24%. Nearly 500,000 immigrants call Minnesota home, a population that includes citizens and non-citizens, students and workers, and refugees who fled their home countries. In 2018, about 9% of Minnesotans were foreign-born, with the largest immigrant groups from Mexico, Somalia, and India. The most common languages spoken in Minnesota, other than English, include Spanish, Somali, and Hmong. Before we get further into the risks of low health literacy, what are the benefits of high health literacy? According to a recent analysis on Medicare beneficiaries, on average, Medicare beneficiaries in counties with the highest health literacy levels experience better outcomes than those living in counties with the lowest health literacy levels, including 31% more Medicare beneficiaries received flu shots. There were 26% fewer avoidable hospitalizations, 18% fewer emergency department visits, 13% lower costs per beneficiary, and 9% fewer hospital readmissions. In addition, there could be 670,000 additional Medicare beneficiaries receiving a flu shot each year, nearly 1 million fewer Medicare hospital visits per year, and a $25.4 billion in medical savings annually. Research shows that patients with low health literacy are more likely to visit an emergency room, have more hospital stays, are less likely to follow treatment plans, and have higher mortality rates. In addition, people with low health literacy are more likely to report their health as poor. In particular, seniors' limited health literacy is associated with worse health status and quality of life and early mortality. Low health literacy is associated with a wide array of adverse health outcomes, including poor self-rated overall health status, limited knowledge of chronic disease management, and lower medication adherence. Studies have also documented that low health literacy is associated with higher health care costs, higher use of emergency services, and patients with low health literacy are twice as likely to be hospitalized, and when they get to the hospital, they often need to stay longer. Why does this happen? Patients don't understand treatment regimens or the importance of following them. They present at later stages of illness after waiting until symptoms are advanced or until the problem is severe before seeking help, and they use the emergency department more often. Patients may also have trouble understanding discharge instructions, the things that they need to do to stay out of the hospital in the future. The United Health Foundation ran an ad campaign in the July 2005 Parade magazine with the heading, "Medical studies indicate most people suffer a 68% hearing loss when naked." The ad campaign was based on a study that found that patients often forgot their medical diagnosis once they left the medical office. In the study, patients could not recall 68% of the diagnoses told to them in a medical visit. When there were multiple diagnoses, patients often could not recall the most important diagnosis 54% of the time. Patients can forget up to 80% of medical information that a healthcare provider tells them as soon as they leave the office, and nearly 50% of what they do remember is remembered incorrectly. Patients with less than a high school education remember only 38% correctly, while patients with college degrees remember up to 65%. Patients tend to focus on diagnosis-related information and frequently fail to register instructions on treatment. In particular, Individuals can only process a small number of new concepts at a time, and this may be even harder when the patient is acutely ill or if the information is not linked to a specific after-visit behavior. A recent study found that individuals with below basic or basic health literacy skills had significantly greater frequency of healthcare professional visits. Individuals with below basic or basic health literacy averaged nearly 12 total healthcare professional or EI visits annually, compared with 7 healthcare professional visits for those with above basic health literacy. Lower health literacy individuals also have greater prescription expenditures compared to individuals with above basic health literacy, over $800 more per year per person annually. In the past, healthcare professionals instructed patients with newly diagnosed asthma to take a bronchodilator medication. Today, healthcare providers task patients to monitor their asthma with a peak flow monitor, correctly use inhalers, manage therapy with tapering doses of steroids, and avoid triggers that worsen their asthma. Additionally, patients are expected to properly use but not overuse the emergency department, their primary care physician, or subspecialists. To meet these expectations, patients need information and must have sufficient reading, computational, and self-management skills to use that information. A gap often exists between what patients actually understand and what healthcare professionals expect them to know or think they know. Health literacy is not only important for self-management of chronic conditions, it also affects the spectrum of healthcare, from prevention and screening to history taking and explaining diagnoses and treatment. People with poor literacy skills are less likely to understand and remember medication advice. Low health literacy increases U.S. healthcare costs by an estimated $106 billion to $238 billion per year. Some reports estimate this to be even higher. When one accounts for the future costs of low health literacy that result from current actions or lack of action, the real present-day cost of low health literacy is closer in range to $1.6 trillion to $3.6 trillion. %, or 1 in 8 adults in Minnesota have below health literacy, and 1 in 5 have below basic numeracy skills. Geographically, 3 in 8 counties have populations where 15% have below basic literacy. Patients with low health literacy skills have insufficient reading, writing, or numeracy skills to effectively function within the healthcare environment. They may not be able to adequately follow directions for their care as described in written materials, understand how to take medications, or have more difficulty in managing chronic or long-term conditions on a day-to-day basis. They also have trouble providing information about their health problems to healthcare providers. Patients with low literacy often do not realize what information healthcare professionals need or lack the health vocabulary to report symptoms accurately. Before we get into the signs of low health literacy, let us go over some myths about low literacy. Myth: people who have limited literacy skills are dumb and learn slowly, if at all. Fact: most people with low literacy skills have average IQs and function quite well. In fact, most people with low literacy skills are of average intelligence and function reasonably well by compensating for their lack of reading skills. Myth: people will tell you if they can't read. Fact: since there's a strong social stigma attached to limited reading and writing skills, nearly all non-readers or poor readers will seek to conceal this fact. Among patients who do admit trouble reading, 40% feel shame, and more than 50% never told their spouses or children about their reading problem. Myth: years of schooling is a good measure of literacy level. Fact: years of schooling tell what people have been exposed to, not reading skills they acquired. Surveys show that, on average, adults currently reading 3 to 5 grades lower than the years of schooling completed. It is not practical to give every patient a health literacy test. People who have difficulty understanding verbal and written information have telltale behaviors. Here are some things that you can look for to help you recognize when patients are having a difficult time, such as Making excuses. I forgot my glasses, I'll read it when I get home. Let me bring it home to discuss with my children or spouse. Using humor or clowning around. Perceived resistance. Someone getting frustrated, not wanting to listen or follow instructions, has stiff body language. For example, they may not nod or shake their head to indicate agreement or disagreement. Someone who has no questions. This may not mean that they understand everything or they do not ask any questions at all, rather than reveal that they don't understand what's going on. Missed appointments or not refilling prescriptions when expected. It could be that the patient is unable to read the appointment slip. It may also mean they don't have a system at home to help them remember an appointment. Waits to seek help until they are so sick that they need to go to the ER or hospital rather than to the doctor's office. Non-compliance with medication. The patient may not understand the importance of the medication and why they need to take it or how they are supposed to take the medication. Unable to name medications or explain their purpose or dosing. The patient does not fully understand the reason the medicine was prescribed, only that they are to take it. Identifies pills by looking at them, not reading the label. Patients with low health literacy cannot read the label on the prescription bottle. They will memorize the pill's shape and color to identify it. When asked to read or write something, a person with low literacy may read very slowly or stare at the page they're supposed to read, but not move their eyes back and forth. Ask questions about things that are clearly stated in the document. Fill out a form with incorrect information or leave sections empty. Bring a friend or relative with them who helps with reading and writing. The healthcare environment is very complex. Even people who read well and are comfortable using numbers can face health literacy issues when they aren't familiar with medical terms or how their bodies work. They have to interpret statistics and evaluate risks and benefits that affect their health and safety. They are diagnosed with a serious illness and are scared and confused. They have health conditions that require complex self-care. Can you read this? A person with low literacy would have trouble. It is best to use simple, clear, medical, jargon-free language to avoid any opportunity for misunderstanding. Clear communication is plain language. Simple messages, need-to-know information, anticipating misunderstandings, clarifying and confirming understanding. In other words, clear communication is written or spoken communication that helps patients to understand and act on healthcare information. Health literacy is a complex concept that depends on the quality and clarity of the communication as well as the skills and experience of the patient and the healthcare provider. Plain language is important, but health literacy communication also means making the context relatable and actionable for your audience. It is important to understand that readability, plain language, and health literacy are interrelated, though each means something different. Readability is a measure of how easy a piece of text is read and understood. It is calculated using formulas to determine a grade level or a readability score. Readability scores are approximations as they do not measure grammar or content organization. Readability formulas take into consideration sentence length, sentence structure, and the average syllables per word. These factors help assess whether the text is likely to be understood by the reader. Different elements of writing can contribute to readability, like choosing familiar terms over unfamiliar or complex terms. The principles of plain language focus on information that is clear, concise, and logically organized. Plain language is the practice of communicating, verbally or written, in clear, simple terms that a majority of audiences can easily understand. Plain language is more than using plain words. It's also about providing context. In healthcare plain language, it aims to make health information easier for patients and caregivers to understand and to use by not using jargon and writing or speaking in a conversational style using active voice. When writing or speaking in plain language, it is not unprofessional. It's not dumbing down the message or talking down to the audience. When you speak, write or speak clearly and get to the point without using unnecessary words or technical jargon, you get your message across more quickly and increase the chance that information will be understood and used. Plain language is not baby talk or an attempt to be folksy or playful, stripping out unnecessary technical and legal information, just editorial polishing after you're finished, nor imprecise. Some examples. Which is easier to understand? Lithodial fragments ought not to be projected by the inhabitants of vitreous abodes. Or, people who live in glass houses shouldn't throw stones. A perissodactyl ungulate may be propelled toward a body of aqueous fluid, but such ungulate cannot be compelled or forcibly induced to imbibe such fluid. Or, you can lead a horse to water, but you can't make him drink. Patients often have a hard time with medical terminology. What patients say and mean, and what they mean can be equally confusing to the healthcare provider. Helping people ask and understand questions is a large part of dealing with health literacy. Examples of communication challenges include faulty recollections of previously given information or providing evidence-based information to what patients may find on the internet. I think my doctor called it gastroparesis or something like that. Well, I found this on the internet and it was written by a doctor. So is this what I should do? I'm not sure what the medicine is, but it looks like DIGIT, something. He said it was for my heart. Medical terminology is a problem for both the patient and the healthcare provider. Healthcare providers often use words about medication, treatment, or test results that may be unfamiliar to the patient. Patient may hear terms incorrectly, write them down incorrectly, or have difficulty reading the healthcare provider's writing. While some use of medical jargon is necessary, healthcare providers should try to limit the amount of medical jargon they use and recognize that patients may be reluctant to ask for definitions of unfamiliar words. Healthcare professionals can also unintentionally use familiar terms with unfamiliar alternative meanings. Examples would be culture, stool, or positive, which have different definitions depending on the context. According to the CDC, although about 2/3 of Americans have prescription medication, about 20 to 30% of medication prescriptions are never filled, and about 50% of patients do not take their medications as prescribed. Patients with low health literacy have 3 times greater likelihood of incorrect interpretation of prescription warning labels and have a potential for misuse of their medications. One study found, for example, in the warning label that states "do not chew or crush, swallow whole," some patients were interpreting it as chew pill and crush before swallowing. Another study found that only 30% of patients with limited health literacy skills were able to answer correctly what it means to take 2 tablets twice daily, and 42% couldn't understand take on an empty stomach. The USP, an independent scientific nonprofit organization focused on building trust in the supply of safe, quality medicines, attributes about 1/3 of all medication errors to confusion with medication labeling. Thousands of patients do not take their medications correctly. Some take too much, others take too little. Some use a tablespoon instead of a teaspoon. A study looking at dosing errors among pediatric population found that nearly 85% of parents make dosing errors when giving their children liquid medications. Parents have also been reported to pour oral antibiotic suspension into their child's ear instead of giving by mouth because it was prescribed for an ear infection. To help improve patients' understanding and reduce medication errors, the AHRQ developed a set of explicit, standardized instructions for taking pills. These instructions follow the Universal Medical Schedule, UMS, which uses standard time periods like morning, noon, evening, and bedtime to simplify complex medicine regimens. Healthcare providers can improve health literacy if they practice clear communication strategies and techniques at the appropriate literacy level. The top best practices for health literacy include practice health literacy universal precautions for health communication, use plain, non-jargon language to facilitate understanding, limit information to 1 to 3 need-to-know items, elicit questions in a patient-centered manner, and use teachback to confirm adequate communication. Because limited health literacy is common and it is hard to recognize, experts recommend using health literacy universal precautions. You can't tell by looking whether someone is at risk for misunderstanding the information they receive, so the goal is to communicate in ways everyone can understand. Healthcare providers should assume that all patients and caregivers may have difficulty comprehending health information and should communicate in ways that anyone can understand. Studies show that even those who can read at higher levels or have more knowledge of health still prefer simple health information. Organizations such as the American Medical Association and the Agency for Healthcare Research and Quality endorse adopting universal health literacy precautions. Health literacy universal precautions are aimed at simplifying communication with and confirming comprehension for all patients so that the risk of miscommunication is at a minimum, making the office environment and healthcare system easier to navigate, and supporting patients' efforts to improve their health. Research shows that interventions designed for people with limited health literacy also benefit those with stronger health literacy skills. Communicating clearly helps people feel more involved in their healthcare and increases the chances of following through on their treatment plans. All patients appreciate receiving information that is clear and easy to act on. The following are a series of best practices for improving health communications to help patients and their caregivers better find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Convey an attitude of helpfulness. Ask open-ended questions to get patients to open up. What and how questions work well. Start by asking, "How can I help you today?" Listen. It is so easy to forget this critical piece of clear communication. Giving the patient time to talk about their problems is very important and doesn't make visits any longer. Encourage patients to speak up and ask questions. Assume that patients will not understand and let them know that what you are talking about is difficult. Let me know when you have questions. The when gives them the impression that you're expecting them to have questions. Take responsibility for communication breakdowns. One of the most important things to remember in creating a shame-free experience is to remember that it is your job as a healthcare provider and educator to help the patient understand regardless of why they may have difficulty. I didn't explain that very well. Let me try again. When you find that someone does need assistance, provide help confidentially. It is very important to look at how we explain things, specifically how we are talking and what words we are using. Use as much as possible plain non-medical language, words that anyone can understand, often called living room language because you use words that you use talking to your family or friends at home. Keep away from medical jargon and terminology. Try to speak slowly and clearly and strive to mirror a patient's vocabulary. Speaking more slowly gives the patient time to take in what's been said and may help them develop important questions. If you must use medical terms, then explain them as well. Patients want to understand their medical conditions and treatment plans. Try using analogies. Analogies can be very helpful because they can explain a concept that is unfamiliar to a patient in a more familiar way, such as describing arthritis like a creaky hinge on a door. The key thing to remember when using analogies is that you need to understand the patient's social and cultural context as well. It doesn't make sense to use an analogy using a rural setting if someone has never been outside an urban area, or vice versa. Use pictures, models, or video. People can learn in all different kinds of ways. Using pictures, models, or video can help people see parts of the body they would normally not be able to see, or help understand how a particular procedure or therapy may happen. Limit to the most important concepts. Healthcare professionals often want to give the patient everything they can in a short amount of time they have. People can only remember 1, 2, or 3 pieces of any conversation. Break down the information into small, manageable steps. Complex instructions are more challenging to understand. Remember and follow. Information or instructions should be simplified into individual steps or units and should be. Be aware that there may be ethnic or cultural differences in word choice by patients to describe symptoms. One study found that while clinicians describe asthma symptoms as wheezing or shortness of breath, Black or Hispanic patients most often used upper respiratory descriptors such as tight or itchy throat. White patients, on the other hand, had the tendency to use only lower airway descriptors such as heavy chest or hard to breathe. Nearly 50% of the population of Minnesota speak English less than very well, meaning that they have a limited English proficiency. Nearly 30% only speak a language other than English. Recent research suggests that adverse health outcomes that affect limited English proficient patients are caused more frequently by communication problems and more likely to result in serious harm compared to English-speaking patients. When compared to English-speaking patients, limited English proficiency patients have longer hospital stays, especially when professional medical interpreters are not used at admissions and or at discharge, have a greater risk of infections, falls, and pressure ulcers, a greater risk of surgical procedure delays due to difficulty understanding instructions and including how to prepare for procedure, and a greater chance of readmissions for certain chronic conditions due to difficulty understanding how to manage their conditions and take their medications, as well as which symptoms could prompt a return to care or when to follow up. Strategies to help LEBP patients include assess the percentage of foreign language use in your population and consider translating commonly used materials. Consider using professional interpreters. Research has shown that using family members as interpreters is not always successful or effective. The potential for misinformation or misunderstanding is high. Include pictures and other visuals to support verbal and written information. Minnesota consists of many diverse populations and cultures, which are growing all the time and making it vital that healthcare providers are culturally and linguistically capable of delivering culturally appropriate services. Culture influences individuals' health beliefs, practices, behaviors, and even the outcomes of interventions. Every patient is unique and has their own culture shaped by many factors such as race, ethnicity, geography, education, income, religion, sexual orientation, and gender identity or expression. Healthcare providers need to recognize the unique culture, language, and health literacy of diverse patients and communities, as well as how each patient's social cultural background affects their health beliefs and behaviors. Understanding these types of social determinants of health will allow healthcare providers a better care for multicultural populations. The impact of these cultural and social determinants, language barriers, and health literacy on clinical care is increasingly important in the delivery of quality health care. Culture refers to integrated patterns of human behavior of racial, ethnic, religious, or social groups that include language or communications, ways in which patients and families from diverse cultural backgrounds communicate, including verbal and nonverbal clues, and how this may differ within and amongst cultures. Eye contact or physical touch will be expected in some cultures and inappropriate or offensive in others. Actions or customs. Differing roles of women and men in society may determine who makes decisions about accepting and following through with medical treatments. Disease-related dietary advice will be difficult to follow if it does not conform to the foods or cooking methods used by the patient. Beliefs, values, institutions. Religious faith and spiritual beliefs may affect healthcare-seeking behavior and people's willingness to accept specific treatments or behavior changes. Effective healthcare provider-patient communication leads to an increase in patient satisfaction, better compliance, and improved outcomes. In multicultural and minority populations, the issue of communication may play an even larger role because of behavioral, cognitive, linguistic, contextual, and cultural behaviors that preclude effective communication. When communication is not culturally sensitive, there is an increased risk of miscommunication leading to poor adherence to treatment with an increased likelihood of adverse health outcomes. Each patient's unique culture influences their perspectives, values, beliefs, and behaviors regarding health and well-being. These factors give rise to variations in recognition of symptoms, thresholds for seeking care, comprehension of or agreement with management strategies, expectations of care, including preferences for or against diagnostic and therapeutic procedures, and acceptance. Cross-cultural issues in healthcare include language, including illiteracy and health literacy. Language and communications problems may lead to patient dissatisfaction, poor comprehension and adherence, and lower quality of care. Socioeconomic barriers to access are greater in minority and immigrant groups. Educational differences, diverse health and disease belief systems, alternative and complementary health medicine beliefs and practices versus traditional or Western medicine, religious differences, power and privilege. To deliver culturally sensitive care and improve communication, recognize that culture extends beyond skin color, find out each patient's cultural background, conduct culturally sensitive evaluations, elicit patient expectations and preferences, and understand how your own cultural identity affects your practice. Identify the patient's core cultural issues, explore the meaning of the illness to the patient, explore the patient's social context, negotiate across the patient-physician culture to develop a treatment plan that is agreeable to both sides. AskMe3 is a patient education program designed by the Partnership for Clear Health Communication to promote communication between healthcare providers and patients in order to improve health outcomes. The program promotes the asking of 3 specific questions to help encourage patients to be active in their visits and to empower them to be sure they know the answers to the questions at the end of every visit with a healthcare professional. It provides a consistent approach to patient-provider dialogue and allows patients to get the information they need to manage their health. Making sure that you, as a healthcare professional, provide the answer to these simple questions will help you give what the patient needs to know most regarding their diagnosis, treatment, and context. The 3 questions are: what is my main problem? Explain in living room language what their diagnosis is. What do I need to do? Tell them what they need to do. What is their treatment? Why is it important for me to do this? Provides context and motivation for them to continue treatment. Use teach-back method, where you can ask the patient to demonstrate that they understood and, if necessary, reteach the information. This technique creates the opportunity for dialogue in which the healthcare provider provides the information, then encourage the patient to respond and confirm understanding before adding any new information. When using the teach-back, do not overload the patient with too much information before asking for understanding. Don't wait until the end of the visit. Make sure that you ask throughout the encounter, chunking the information into sections and check in along the way. Before using teach-back, check the person's baseline understanding of the information. Do they already know this information, or are you assuming they have more baseline knowledge than they do? Use simple terms to explain or demonstrate. Minimize medical or other jargon and avoid words with multiple meanings. Then ask the person to demonstrate understanding in their own words. For example, I want to make sure I was clear about the side effects of this medicine. Can you explain back to me the things you need to watch for? Identify and address any misunderstandings. Pay close attention to what the person is teaching back to you to see if they misunderstood anything. If needed, clarify anything that did not seem to be clear by using a different approach, such as an illustration, video, or demonstration, and recheck understanding. Keep repeating the previous steps up to 3 times and ensure that there are no misunderstandings. Close the loop. Finalize the process. Ask the person to tell you everything from the beginning again. This helps people to remember the sequence. Be aware, even if someone gets it, this doesn't mean they will remember it. So rechecking the next time you see them is a good idea. It is very easy to overload the patient with too much information, which is why it is a good idea to deliver information in bite-sized pieces. This is the chunk and check method in teach-back. Simplify by providing just 2 to 3 main points for the first concept, then check for understanding before going on to the next concept. Tips when using chunk and check. Think about what people really want to know. Most people only remember about 3 things at any one time. Move from points that are the most important for people to know to the least important. Be specific and concrete. To recap, ask patients to demonstrate understanding. Chunk and check. Do not ask, do you understand? It is important that you ask the patient to explain or demonstrate understanding in a way that is not demeaning. Also, do not appear to be rushed, annoyed, or bored during these efforts. You can also think of this as the show back technique. Sometimes it is most appropriate for a physical demonstration of what the patient will need to do and for them to show you back how to do it. Research shows that practice by doing increases understanding and retention by 75%. This 33-second clip from the show House MD demonstrates the value of a show back technique. Remember, try not to make it feel like you're testing the person's knowledge. You just want to make sure they understood you and that they know what to do. Here are some sample phrases for how to ask people to explain back their own words. Would you just mind explaining that back to me so I can check I've covered everything? I'd like to make sure I was clear about the side effects of taking this medicine. Can you please explain to me in your own words the things you need to watch for? People often have trouble remembering how to do this. Could you just go through how you would make this work for you? What you do not want to use is, do you understand? Other things to consider that can affect a person's ability to learn or understand. The effects of aging, such as loss of vision and hearing, tend to affect the capacity for learning. Changes in health. Pain and fatigue that often accompany both acute and chronic illnesses can leave adults with little energy or motivation to engage in learning activities. Being anxious and concerned about health issues that affect a person's ability to stay focused, and not to mention cultural and language barriers. Use these tips to help you choose appropriate information for your patient. It can be difficult to pare down and simplify materials when the natural tendency is to want to include everything. Try to keep the information short and simple, and focus on only 1 or 2 or 3 key points. Use of active voice helps to keep things concise and less wordy. Limit medical jargon. Sometimes it may be necessary to include specific terms. When possible, include a definition along with the medical term so the patient doesn't need to look it up or guess what it means. Use headings with keywords to help the patient know what is important about the section and why they should read it. Use larger type. Aim for 12 to 14 point size and always use a sans serif simple font, for example, Arial or Verdana. Other things to look for are use of simple illustrated pictures, many translate to across languages, and a sensitivity to cultural preferences. Whenever possible, provide health information in multiple formats. For example, in addition to print, consider audio, video, interactive graphics, or models. Multimedia can improve both learning and engagement, particularly for users with limited literacy skills. The following are some patient-friendly online resources that you can use during an office visit or as recommendations to patients for more information. Medline Plus is the National Institutes of Health website for patients and their families and friends. Produced by the National Library of Medicine, it provides extensive information from the National Institutes of Health and other trusted sources on over 1,000 diseases, conditions, or drug information, lab tests, and wellness issues in easy-to-read language. Use Medline Plus to educate patients about the latest treatments, look up information on a drug or supplement, find out the meanings of words, or view medical videos or illustrations. There are also links to the latest medical research on topics such as links to thousands of clinical trials on a disease or condition. The topic pages in Medline Plus are printer-friendly, so you can print them out during a patient visit. Medline Plus has health information in multiple languages. You can browse either by language or by health topic to find health information in languages other than English. The website can be flipped easily over into Spanish. Medline Plus also includes HealthReach, a national collaborative partnership that is a resource of quality, multilingual, multicultural public health information for those working with or providing care to individuals with limited English proficiency. Neumars is a nonprofit children's health system. KidsHealth.org provides easy-to-follow articles, slideshows, videos, and health tools. Articles are doctor-reviewed and provide advice on hundreds of physical, emotional, and behavioral topics, from before birth through the teen years. There are separate sections for parents, kids, and teens, with each section written specifically for that group. The National Library of Medicine Drug Information Portal is a gateway to information on more than 49,000 drugs. You can search by the drug's trade name or generic name. Once a drug is found, a summary of the drug's type and usage is given, as well as links leading to further information on one of the portal's resources, such as a consumer-level explanation of the drug at Medline Plus. Within a given drug record, you may click on a drug category and retrieve drugs with the same or similar uses. DailyMed is another website operated by the National Library of Medicine that publishes up-to-date and accurate drug labels, also known as package inserts, for healthcare providers and the general public. The content of DailyMed is provided and updated daily by the FDA, which collects them from pharmaceutical companies for both prescription and over-the-counter drugs. DailyMed also provides information from the FDA about some medical devices for human use. Elm, the eBrary Minnesota, gives Minnesota residents access to magazine, journal, newspaper, and encyclopedia articles, including the Consumer Health Complete database. Free access is available to any IP address located within Minnesota. The Consumer Health Complete database provides popular and professionally written information for patients and consumers covering all health-related topics, from mainstream medicine to the many perspectives in complementary, holistic, and integrated medicine. The Federal Drug Administration maintains a consumer and patient information website. There are consumer information by topic, which includes food, drugs, medical devices, and vaccines, and more, or by audience, which has links to information especially important to the health of a particular group, such as seniors, women, parents, and caregivers of children, health educators, and students and teens. If you are interested in finding examples of health literate patient handouts, here are a few sites to explore. Elspeth Murray's poem, "This Is Bad Enough," underscores the importance of taking health literacy demands into account when communicating health information or interacting with patients in a healthcare setting. If you are interested in learning more about health literacy, there are tutorials and workshops available. The CDC offers online health literacy courses for health professionals, and there are also several non-CDC courses that may be of interest. Included with this presentation are several attachments. A medical jargon exercise to test your ability to provide plain or living room words for medical terms, a plain language checklist for the creation of written materials, a list of health literacy resources for you and your patients, and a list of references consulted for this presentation. Thank you for reviewing and your interest in learning about health literacy and what you as a healthcare professional can do to ensure effective communication and better health and well-being for your patients.